Okay, I'm just going to get started and jump into it. So, hi everyone, thanks for joining us today. Today we're going to be talking about 4 reasons why PROMs and PREMs are harder than you think, although I might be taking a more positive spin to it going forward. Just a really quick introduction. I'm Michael Millar, CEO and founder of Verto Health, deep tech founder from Origins, have worked in government for Ontario eHealth strategy. And I'm joined today with Dr. Michael Anderson, who's the CMO at Verto, but that's only his part-time job. He works a lot in the surgical oncology and palliative care space and has been a trusted advisor for many, many health networks. So I'm going to just jump right into PROMs and PREMs, but I wanted to start a little bit with a baseline. And often people throw out the terms PROMs and PREMs, but behind that, the anatomy of what it is actually a patient reporting framework, right? So PROMs and PREMs are just something that you do in a patient reporting framework. And so a general patient reporting framework we see as 4 kind of distinct elements. The first, you have to have a population that you're looking to do the patient reporting with. Then you have to choose an assessment or an instrument. And we'll talk a little bit about quality improvement versus research, but you have to understand what are the questions that you're asking, what are you trying to learn? Then you have to have an administrative engine. So this is a team or someone, if you're just doing patient reported outcomes for a family health team, sure, that could be your admin or that could be a physician assistant. But when you do it for an OHT or Ontario Health team, you need a whole team. You need an army to be able to conduct it correctly. And then finally, you have to have a reporting framework. How do you get that data back to policymakers, administrators, researchers, clinicians, and patients, right? So these are the 4 major kind of components that we see in a patient reporting framework. And so the goal that we all want to get to is to create a cycle of effective patient reporting, right? What you want to do, the ideal goal is a patient or caregiver provides a response. That response is collected through the assessment or instrument that you have, and then the information that you need to move on flows to the right people. And this is in its ideal, in the idealistic sense, if it operates correctly, it has immense value because everyone from providers to the administrators to researchers to policy creators can actually see that data and understand how to tweak the system and improve it. But it's not that easy, right? If it was that easy, then we should be awash with these solutions. Like every time we interact with the healthcare system, we should be getting a patient some kind of survey that lets us know how to work, what that experience looks like. Our providers should understand how we report into it. We should be doing real-time iterations and policy improvement, but that's not where we're at. Instead, we actually have an ecosystem where there's quite a few of these patient-reported frameworks that have outright kind of failed. They're stagnated. And it's pretty easy to spot it. It can be like that old dusty kiosk in the back corner, or it can be the guffaw that a patient makes before they fill in the form for the 4th time. I mean, we've seen it. We know what PROMs and PREMs delivered incorrectly looks like. And so what we're going to focus on today is a little bit of talking, and I know that the title was on why they're harder than you think, but we want to take a little bit more of a positive spin to say, what are some things that you can look at to create a healthier patient reporting framework? What are the ways that what are the key principles that if you focus on them, then we believe that you can actually create effective PROMs and PREMs? And it's a little bit of a different spin, but we're going to go through that. And so it's going to be interactive at every point. So the first point, the first thing that we think that you have to focus on is to understand that the collection medium and context matters. And so what do I mean by this? What I mean by is that you have many options to choose how you collect a PROM and a PREM. You can use traditional ones, such as forms that are filled inside the clinic, or you can use physical snail mail to actually collect it, or phone surveys. But we are in 2022, so you also have SMS, you have chatbots, you have email. So the number of vehicles that you have really actually has increased. But maybe Michael, talk a little bit about what you've seen in practice. What are the types of forms that you've heard being used for PROMs and PREMs collection?
Yeah, so everything from good old, pen and paper to, to online to virtual forms. But I think almost more than the how you collect it, there's a couple of key things. And one is, to be valuable, it has to be valuable to the clinician, and it has to be valuable to patients. And um, I've heard from no shortage of patients the experience of, I filled out all these forms before, all these questionnaires before my appointment, and I sat with the clinician and they hadn't looked at one of them. They asked me the exact same questions over again. And in fact, that not only it doesn't serve any purpose, it's actually quite detrimental, because people end up going, don't they look at this? I did all this work. Hey, you asked me the same question. 5 different people asked me the same question. Don't you people talk to each other? So it actually erodes, not only not being beneficial, that scenario erodes confidence. So I think it's really important that when we collect this sort of information, it has to be actionable. People have to perceive that we look at it. And I think that's really critical. There has to be value for the patient and family doing this work, and there has to be value for the clinicians. And that's the only way I find that you get buy-in and people see value. Unfortunately, too often we do it in a context where people don't perceive value, and hence they pretty soon check out and they don't answer things, or it just erodes confidence.
Yeah, and like one of the other things that we've noticed in some of our implementation, so we didn't do a formal PROM or PREM for many of our clients, but just simple experience surveys. And the timing matters, right? So like when you choose a medium, when you choose snail mail, you're basically signing up for a low response rate with a 2-week turnaround between feedback. And so any experiences on that, Michael?
Yeah, I mean, well, a lot of the questionnaires that are used were from research contexts that have, sort of tried to be crammed into a clinical context. So they ask questions like, today, how did you feel? But when it's done 3 weeks before your appointment or 5 weeks after, it's completely detached from the clinical interest. I think that's important. If it's detached from any clinical, actionable experience, then its value disappears. So the timing's really important. If you do it, within a day or two of an appointment, there should be some linkage to something people see value in. Maybe that's, the overarching theme is these were research tools that in a research context aren't linked to anything that's actionable immediately, but to be valuable, these have to be linked to the immediate. So the timing is critical.
Yeah, so that's actually our second point, which is to not conflate quality improvement with research. And so one of the important things that we're focusing on here is that when you look at PROMs and PREMs literature, it is a wash and it's a mix. You have strong research with focused instruments that have like generic PROMs and PREMs. Then you have the middle space where they do like a PDSA cycle with iterative kinds of PROMs and PREMs. But the interesting thing is there isn't much discussion or solutions out there on well-developed, deployed quality improvement PROMs and PREMs. And I think that in the context of Ontario health teams, what you're trying to do is do PROMs and PREMs with the sake of actually improving that domain of care. And so you need to have fast iterative cycles. To me, that sounds like quality improvement. And so one of the things is like, going into these projects, really focusing on what is a goal. Are you trying to change outcomes within a set time period? Or are you trying to learn something about the population or a specific disease area? So, I think that, what are some techniques that teams can use to make sure that if they want to change outcomes, how do they need to change the way that they engage with clinicians and patients?
Yeah, I think these have to, we almost have to reframe this. And, these tools were set up in many ways to be valuable for a system or for researchers, and they're at a system level. But they have to be, if they're going to be functional and valuable, they have to be valuable to patients and they have to be valuable to clinicians. Otherwise, they sit in a space that is sort of decoupled from the clinical experience. And I think that's problematic, because if people don't see value in it, both the clinician and the patient, I think the quality of information goes down that people report. I think the engagement, or how likely people are to participate in PROMs and PREMs reporting, goes down. These are always framed as a tool to bring the patient's voice into the experience. So the challenge is, if people don't see their voice being heard and they don't have that reflected back, in real time or in near real time, then they disengage, and the whole notion of these things being useful and bringing the patient voice forward, it fails. I do understand the idea that you're trying to do system change, but people don't think about system change. They think about, how is this impacting my care? So we have to reframe these in a much more real-time, focused around the patient. And I do acknowledge that these things strive to change the system as well, but they have to be linked to the clinical experience to be valuable.
Yeah, and you're always leading into the next point, but I really need to stress the fact that data quality is paramount in these systems. And when you focus on the system rather than the relationship that the patient, because when the patient responds to a PROM and PREM, it's all about understanding personas and their angle. They are responding to it as an individual. They are not responding to it as a system reporter, as a dispassionate kind of third party. They are responding to their experience and how they went through the system. And so if they don't feel like the medium has been created for that, then you will start getting the dispassionate responses that you don't even want in a PROMs and PREMs reporting framework. And so, when you create these programs, just, often there's system level motivations for tracking information or everything there. But if you take your first step, trying to embed those system reporting metrics as the objective of your project, rather than saying, we need to create a dialogue with our patients, we need to collect this information and then build upon it, then that's really when you start seeing those abandoned frameworks, right? Because the things that make the ecosystem work are the interaction between the patient and the provider, which is the relationship. It's not actually the system actors who keep the system operating going forward.
And
okay, I'm going to go.
That does highlight too that we have to realize that these PREMs and PROMs done well can actually improve the therapeutic relationship, and done poorly actually can impair the therapeutic relationship. So that that we have a tool that can potentially be really advantageous and beneficial, but if we don't implement it well and thoughtfully, can actually do harm.
Yeah, and that leads us to the last kind of recommendation that we have, which is don't delay the insights that you report back to the providers as well as patients. And so a lot of the times, and this is actually, it kind of links into the don't conflate quality improvement with research, because getting insight about a population when you're doing research, you're really focusing on the quality of the assertion or the results and the efficacy of what you're actually proposing. But when it comes to quality improvement, as soon as you collect that information, and let's say that a patient reports something that was very impactful to their personal experience with the care, if that stagnates and the entire team, the care team, isn't aware of that information, then that's exactly to your point, which is you can erode that trust, because when they sent out the PROM or PREM, they don't know that that's a separate process. They think that they're communicating with their care team, right?
It's interesting. We have all sorts of kiosks and various efforts at PREMs and PROMs that sit idle now, and they came into play because they were often part of a requirement of our funding envelope. We had to do this, but they've become useless because they weren't actually embedded into the clinical experience. So there's no value for anyone to do them. Patients knew that they answered these questions that we didn't actually sit down and go over with them. Hey, you told me that your sleep is terrible. You told me that you're having intractable nausea. Until we link them into the clinical experience, it's hard to get buy-in. It's hard to get buy-in on both sides. As a clinician, you're busy, and doing this where you don't see it connected to the clinical experience becomes problematic. So this really does have to be linked in where people see value. And one of even at a system level complaint is when you fill in all sorts of data collection and then it doesn't return to you in any form for a year, 2 years, 5 years, it's really disconnected from why should I be taking the time to do this data entry? Why should I do the time to put effort into this if I don't see it fed back to me in some meaningful, timely fashion?
Yeah, and this is one of those interesting circumstances where, the previous 3 recommendations that we had regarding not conflating it with research, understanding about the relationship, what you'll notice is that if you are genuinely thinking about how to take PROMs and PREMs and embed it into the way that you deliver care at real time, you're going to find that there's some key questions. There's going to be like a few, not pages of questions that you need to answer, but a few key questions that you want to know about the patient as they go through their journey. And, it's important that you think as you choose your assessments and your instruments, what are the types of questions that you ask that are impactful? And then you also think, is this question something that I have to process before I bring it back to the providers? Or is this something that I can just real time provide back to the care team? And so really, when you select your instruments, select your assessments, you should think about simplicity. And we should look to other industries. Like if you look at the other industries, an experience metric for any consumer tool is an NPS survey, Net Promoter Score. It's one question. How likely are you to refer us to a friend or another customer? And the reason why they made it short is because the shorter is, the higher chance that a larger portion of the population will respond to it. And so factoring in your cycle of reporting into how you create your PROMs and PREMs, I think is very valuable.
Michael, in a research setting, even when we do questionnaires that get longer or more complex, the uptake is terrible unless you actually call someone. So you employ someone who calls people and asks them the questions. So extensive and complicated questionnaires have terrible uptake unless you put people in who are actually reading questions, following up. Even at that, it's difficult. So you can drive your response rate down to negligible just by poorly designed or overburdensome questionnaires.
Okay. Well, when we supply the slides back out, we actually are going to supply a checklist or some points that we're actually going to recommend in each 4 of these domains. But I just want to wrap it up a little bit. So really what we've realized as we've talked, and we actually are going to supply our research sources as well in the document, but we find that there's quite a few PROMs and PREMs that fall into a vicious cycle. And this concept of understanding the cycle of PROMs and PREMs is really what we want to kind of make sure people take away from today. And so if you look at it, a vicious cycle is pretty easy to understand. It's if you don't follow it, if you conflate it with research, if you have slow reporting times, if you focus on system measures rather than the relationship, then ultimately what you do is you decrease the level of engagement that the patient feels. And as the patient's engagement level decreases, whether it's because they haven't heard a response or they've done a PREM and they haven't had any other feedback cycle or a clinician in their care team talk about it, you're going to have diminishing patient engagement. And that's how you get the abandoned PROM and PREM network. And so what we want you to do is, really focus on how can you create a virtuous patient reporting framework. And so, and a virtuous cycle is where the PROM and PREM framework actually encourages and delivers more patient experience and engagement. And so the way that we believe that we do it is listening to the tips that we've provided, right? Communicate to them in the medium that they understand, right? Like if you have a cross-section age population that's from youth over to adult, you need to consider SMS. You need to consider chatbots as viable mediums to collect feedback. Then you need to make sure that this data makes it back instantly to the care team, so that not only are you collecting the information, but you're empowering the care team to act on it. And the moment that a patient can realize that there is a connection back to the people delivering care immediately. That's how we feel that you can create a virtuous patient reporting framework where they can use it as a mechanism to report direct feedback, and then you will get increased engagement. So not only does this do wonders from data quality, but it does wonders from a patient experience. It's basically aligned with the quadruple aim. And so the concept is make it better for providers, better for patients, reduce the cost because it needs to be simple and real time. You don't need an army fueling this. And that's actually what brings us to our last point, which is, and this is the only slight plug that I'm going to have, and I'm actually going to make it generic. There are lots of solutions out there. There are lots of technologies that work, but keep an open mind, like use the actual, our framework is generic. We're trying to help you make it meaningful for the patient, communicate in the medium that they want, make sure that you bring reports quickly back to the providers and focus on the relationship. And there are tons of tools, consent management tools, provider defined questionnaires. So let your providers actually add new questionnaires as they see fit. Deliver those results back to the team. These are simple technologies that you can embed in any of your PROM or PREM strategies. And the goal is you can actually use technology to drive this virtuous patient reporting framework. Any last words, Michael?
I do. A lot of funding projects now, and I was at one this past week, have as a requirement PREMs and PROMs built into them. If you're getting this funding, you're doing this project, you have to deliver PREMs and PROMs. But what worries me is the accountability there is actually to the system and to CIHI and the funders. You want this money and this program, you have to do PREMs and PROMs. But the accountability is all to system collecting data. There's nowhere in it that it's linked to that it's valuable, that PREMs and PROMs must be valuable for patients or must be valuable for clinicians. So we do it because we're required to as funding, but the linkage hasn't been made. Who is it supposed to be valuable for? If we don't make it valuable for the people who are present, who are experiencing this interaction, then we will have poor uptake and poor quality. And at the same meeting, a colleague pointed out that they still had a requirement from funding they got 5 years ago that they were to deliver PREMs and PROMs, and they go, I've just kept pushing it off because I can't figure out how to. I don't feel tied in value to it. I'm doing it because it's a requirement of my funding, not because I see clinical value in it. I don't want to keep making that mistake. It needs to be valuable for the clinical experience.
Okay. Well, hopefully you guys found this chat useful. We're going to send out the slides and information around it. We're going to jump to questions now. I see that there's a question in chat. So in your experience, are PREMs and PROMs forced into the system, i.e. does a patient have to complete it as a mandatory requirement? Michael, I think that we tell them that they have to.
So it depends. So the short answer is, in some scenarios, there are certain programs that have, certainly in the past had kiosk setups that insisted that you do your PREM and PROM before you receive care. But generally speaking, no, they're not. They're baked into our deliverables as funders, as system, but they're not sort of enforced at a patient level. You must do this.
Yeah, and I remember you making a story about, like, after a while you saw the patients just furiously just pressing 1 as a response on all the questionnaires, right?
That's the problem of making it, when you make it mandatory for patients to do it, but they don't see value because they meet their clinician and they've not looked at it, they start just entering garbage. They just learn press 1 to get it done. So whatever information you think you're collecting really isn't their voice anyhow.
Yeah. One of that actually makes me, it's something I want to double down on, which is a fundamental belief that we've held, and actually it's part baked into our technology philosophy, which is too much data in healthcare is feed the beast type of data, like get it into the EMR, correct this report. And the part that we're going to, where it comes to head is when we try doing research or any analytics off of that data, right? So if you create data that actually drives operations, that patients and providers see value, what we don't say is that data is higher quality. It is just higher quality, is better data because people actually are invested in the process. And so really, I would say at the underlying, at the foundational level, that is the governing metric of a healthy PROM and PREM strategy versus an unhealthy one, is how good is the data? Because it's a virtuous cycle. If the data quality is good, if the providers know that the data is meaningful and that they use it, then the patients know that the provider is looking at it. And then what you do is you get this cycle where people trust that framework to report that data. And that's actually what you're trying to do with a patient reporting framework. That's my belief. I don't know. What do you think about that?
Absolutely. At the end of the day, that's the virtuous cycle. If people see value in it, they buy into it, it improves. I mean, at the end of the day, what your hope is that this is improving both the system and individuals' care. And until people see individually that this is part of their care and valuable, we won't get high enough quality or meaningful data to do system change. So they are linked to me. When we focus only on the system, we almost ensure that we get crummy data.
Okay. On that note, I'm not going to be the webinar that goes over 12:30 because it's your lunch hour. So we're going to wrap things up. Oh, actually, sorry, we have, there we go. Tarek's basically saying, agreeing, right? So from the concept is excessive measurement. Yeah, don't conflate research. And I cannot stress this as much. And it's kind of doomed to become harder to run a PROM and PREM, because the more successful your PROM and PREM framework is, the more you're going to get people saying, hey, can you add this one question in? Can you add this one question in? And then eventually you become what you don't want to become. So it requires vigilance. And that's why we say aim in maintaining a virtuous patient reporting framework. That should be your goal. Your goal shouldn't be to collect this measure or do this instrument. Your aim is to create a healthy one that creates value for all the people who participate. And on that note, I'll wrap it up. If anyone has any questions on how Verto or how we do this more from a technology perspective, feel free to reach out to our team. But we will be sending out a link to the recording as well as a tips sheet at the end. So thank you guys for joining and spending your lunch. And I hope you guys have a great day.